So we've been talking about the barriers that patients face, and I want to shift gears a little bit and focus on the healthcare providers. So Dr. Jain, I'm going to start with you. Can you speak to some of the obstacles or barriers that healthcare providers face when treating MPN patients?
Sure. So being a healthcare provider and doing this, I can tell you all about the barriers we face. I think going back to that team-based care, sometimes it's easier said than done. Like I said, we need pathology input. A lot of times we need psychology input. Other times we need cardiology input. Some of these patients are getting blood clots, vascular medicine. So team-based care and coordination within those various physicians and nurse practitioners and social workers that can sometimes become cumbersome, requires lots of phone calls. And so in a lot of places, we try to put together these teams where you have kind of like a go-to person to call when you have questions or concerns. The other thing we always are all short on is time. So it's easier to talk about these MPN symptom scores, but when there are 10 questions to ask these patients within those 15 to 30-minute appointments, though that's another barrier sometimes that we face as physicians and as healthcare providers. One of the other important parts is management of some of the side effects of these newer therapies. Every patient reacts differently. Every patient has different side effects that they can have, and knowing those and being able to manage them while keeping them on these therapies, which don't only improve symptoms, but can also sometimes improve survival and improve the natural history of the disease, can be difficult to overcome and handle.
Thank you, Dr. Jain. And what about you, Ms. Smith? Can you speak to any additional barriers that healthcare providers face?
Um, I like Dr. Jan was saying, but one of the barriers that I see that we face a lot is, advocacy groups are great. They're wonderful. We need them. But a lot of patients look at those groups and they lump themselves into that group. And so I try to tell patients, you are individual. You are individual. You need individualized care. It's wonderful to look at the advocacy groups. It's wonderful to follow and you get some good information. But we also have to look at you as who you are and what we're treating and your symptoms, because your symptoms may not be the symptoms that they have.
Really good point. And since we've talked about these barriers, I'd love to wrap this part of the conversation up by giving solutions. So Dr. Jain, you mentioned a couple. You talked about having this one number for all of the healthcare providers to call if there's questions to kind of help to coordinate care. Are there other solutions that you or Ms. Smith can offer to start to overcome some of these barriers in care?
Sure. Yeah. In addition to the multidisciplinary team that we were discussing and having, those people that we can talk to, another barrier that I didn't talk about is a lot of prior auths and having pharmacy support to get some of these medicines that can be really expensive, right? The financial toxicity that can come with some of the medicines that we manage myeloproliferative neoplasms with. Is hard. So having pharmacy support is, again, very important. Having that specialty pharmacy that can help us navigate how to get these medicines to patients quickly and get them in an affordable manner. I think another important part that we always come back to is education of those pharmacists, of patients, of other healthcare providers, helping them stay on top of what new drug approvals come through, what phase 3 trials are available in the community, what the side effects of these medicines are so that they are empowered to be able to help their patients out in the community and also in tertiary care centers.